and their chest care always is paramount and comes first. But linked to chest care, we know that mobilisation is very important, so that in the early days it's really important that patients are sat on the edge of the bed regularly and that we sought suitable, appropriate seating for them very early on. So we obviously work with the occupational therapists with that. We're very lucky here in that we've got early access to maximum support rear chairs. So Neurosciences as a directorate have got 9 chairs that patients can use whilst they're here, take them with them, and then we get one put back into the pool. So normally, in an ideal situation, within 4 or 5 days of a patient coming into Neurosciences, being sat on the edge of the bed and being measured, we can have appropriate wheelchair seating for them with a belt, which is often important if the patient's coughing. It's a tilting space chair with an element of head control in it. And then on top of that, if we and the occupational therapist then feel that they need extras, we can then order that through the normal system. So if they need more chest support, they need more head support, we can do all that. And obviously, if they're then sat up more, their chest care is going to be better. We're more likely to be able to get rid of the tracheostomy. And equally, it's easier then for speech to get involved and for us to start looking and just investigating whether we can form some part of early communication. So just whether the patient can track, whether they're looking at familiar objects, whether there's a change when their family visit, whether they respond to it being night and day. And that's when all the questions start getting thrown up as well about, can we investigate their sensory systems further? Do we need to get audiology involved? Do we need to get ophthalmology involved at that early stage to try and see whether it's a sensory problem that's causing the lack of awareness, or is it the brain injury, or is there something that we can supplement their sensory systems with to help that very early assessment?